webinar for this year. This is the Active Employee General Health Plan Overview. Today we have representatives from Kaiser Permanente, Blue Shield of California, and HealthNet Canopy Care HMO. We're excited to share the presentation with you, and if we do have instructions, which we're going to share shortly, on how you can send us your questions. So without any further delay, I'm going to start.
Welcome to the San Francisco Health Service System Open Enrollment Webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending.
Sorry, I think I forgot to hit share. Did everybody hear that presentation? Okay, that's what I thought. Let me restart that.
The open enrollment period is the time each year when all members can enroll.
You know what? It seems I have some technical difficulties. Jay, if you're able to take over the video.
Welcome to the San Francisco Health Service System Open Enrollment Webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important, please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SFHSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SFHSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Well, good afternoon, everyone. Thank you for joining us today for this webinar to kick off your 2025 open enrollment. As you may know, this is now the 4th year our Health and Canopy Care HMO plan is being offered. And we're excited that you joined this webinar to learn more about the plan and all the wonderful programs that come with it. But first, quick introductions on the speakers. My name is Fred Reyes, and I'm representing HealthNet. And with me today, I have Emma Welch, who's representing our Canopy Care HMO Medical Network. Next slide. So I'm going to hand the presentation over to Emma now to walk you through the partnership that was created between HealthNet and Canopy Care. So Emma, I'll turn it over to you.
Thank you. So Canopy Health is a network offered through the HealthNet Canopy Care HMO plan. So the Canopy Health Network offers an affordable pathway to some of the best healthcare systems in the Bay Area. It includes 5 medical groups. As you can see, John Muir Health Physicians, Skippa, Dignity Health, and Providence, as well as 30 hospitals and over 80 urgent care centers. As you can see on the map to the right, we span over all 10 Bay Area counties. So from Sonoma, Napa, all the way down through San Francisco to Santa Cruz County. For what's new this year, Canopy Care continues to be one of your most affordable options while still providing access to high quality healthcare. As far as our network, the UCSF and John Muir Health Cancer Center opened on the Walnut Creek campus this past February. It's a beautiful facility. And then the UCSF Bayfront location opened in San Francisco last month, so August. And then there are some new telehealth services that Fred will go over later in this presentation. So Canopy Health offers an alliance referral program, which allows you to go outside of your primary care network with a referral from your primary care physician. So this gives you access to the entire Canopy Health network to find a specialist that is right for you or to get a second opinion. So it offers a bit more flexibility. First, you'll meet with your primary care physician, and if deemed necessary, you and your doctor will discuss options within the network. Once that referral is sent and approved by the group's referral department, then you are free to schedule your own appointment. And then if you do have any questions specifically about the Alliance Referral Program, there is a dedicated email that's included on this slide, as you can see. So challiancereferrals@canopyhealth.com. Then I'll hand it back over to you, Fred.
Thank you, Emma. All right, so next we're going to talk about behavioral health solution that we offer our SFHSS members. So when it comes to access to care, we have you covered. We have over 20,000 in-network providers with over 5,000 of these providers that accept both in-person and virtual care, a 24/7 call center, and also integrated care management, which means that if you ever need higher level of care, both your primary care physician network and therapists would work together to provide you with some whole person care. Next slide, please. And so here's a quick glance at the benefits. Important thing to mention that no referral or authorization is needed for outpatient office visits. So as you'll see here, that's a $25 copayment for outpatient therapy. Higher level of care, again, inpatient care in a hospital, detoxification, that would require an authorization, and that's a $200 copay per admit. And then outpatient services, that's things such as alternate care, partial hospitalization, day treatment, inpatient physician visits. That also requires an authorization, but that's covered at 100%. So no cost for members. Next slide. And so in the next couple of slides, we'll cover our wellness programs as well as our value-added programs, which are free or zero cost to our members. So next slide. So a couple of important items we want to cover first before we get into these programs. All the programs that we offer can be accessed online at www.healthnet.com/SFHSS, and members can register to access all the programs. So first up, we have our Real Age Test. This is a personal health risk assessment where you can earn up to a $50 gift card just for taking the test, and up to $50 more for completing some other online health activities. Next, as Emma mentioned, we offer teledoc virtual care at no cost to our members. And this is great when traveling or if your regular doctor is not available. You can talk to a healthcare provider over the phone or video. And sign-up information is listed here on the slide, but it could also be found on the website. And next, we have Wellbe, which is our decision support program that helps members decide on, prepare for, and recover from surgery. And members can also earn a $25 gift card just for completing a couple of the program modules. Next slide, please. And so when it comes to behavioral health wellness programs, we also have you covered there. We provide some great self-help tools and programs to help our members improve both their mental and physical health. So first up, we have My Strength, which provides in-the-moment mood tracking. It also provides instant stress relief actions that can help a member achieve lasting and healthy changes. And next, we have our Unwinding program, which uses mindfulness to help our members build resilience. Members are able to use it throughout the day whenever they find themselves feeling stressed or if they need a quick dose of calmness. And through the use of breathing exercises, meditation, sleep support, visual relaxation, and more, members can start living a less stressed life. Next slide, please. And in these next couple of slides, we'll go over what you can expect when changing plans. Next slide. So one of the most important things to keep in mind is that you will be automatically assigned to a primary care physician under our plan. However, you have up to 90 days to make a correction if needed. If your provider and or medical group under your current plan are also contracted with HealthNet, all you need to do is just ensure that any authorized services taking place in the new year are either submitted to HealthNet or updated by your medical group. Members will be eligible for continuity of care. So this means in certain circumstances, you may be able to continue care with your prior health plan provider. And the last point we want to call out is it's non-urgent appointments can be very hard to come between the period of January and March. So therefore, it's always a good idea to schedule an appointment and confirm availability of your doctor as soon as you can. Next slide. And some pharmacy program basics. Again, we strongly encourage all of our members to get familiar with the new formulary, identify prior authorization requirements, any cost differences there may be. Also note that any prescription authorizations or clinical criteria notes do not get transferred to the new health plan. So if you did go through that process with the previous health plan, in order for that to be a smooth transition and avoid any issues, we always recommend that you try and complete HealthNet's prescription transition forms located under our website. And that applies to prescriptions as well as self-injectables. And that'll allow the authorization under your previous health plan to carry over to the health plan. And next up, one final important thing to remind you about is our open enrollment office hours. This is the opportunity for you to schedule an appointment and talk to one of our customer service agents about any questions or concerns that you have about the plan, or if you're considering making a switch. Next slide, please. So as we close, we just want to summarize on why someone would want to consider choosing Canopy. And again, we provide affordable access to some of the best hospitals and medical groups in the Bay Area. Easier access to specialists through Canopy Health's Alliance Referral Program. Canopy is a network of choice for many doctors, nurses, and their families all around the Bay Area. And finally, HealthNet's whole health member-centric programs and services that support our members' physical, behavioral, and emotional well-being. So this concludes our presentation. We just want to say thank you for your time today. And we hope you found this presentation helpful, and we wish you good health in 2025. Thank you.
Good afternoon, and thank you for joining today. My name is Adam Gunther, and I am a Senior Account Service Representative here at Blue Shield of California. In this presentation, I will be going over, at a high level, the Access Plus, Trio, and PPO plans. I'll also be going over some differences between the three plans and the additional programs available to HSS members in 2025. What's new for 2024 open enrollment? For the Access Plus and Trio HMO plans, as well as the PPO plan, there are no medical plan changes for 2025. The benefits you have for 2024 will be the same benefits you'll have for 2025. All three plans will have a new and improved pharmacy experience, which will require new ID cards. On the PPO plan, HSS has chosen to add Blue Shield Connect. This will replace the services you may have previously received from Accolade, and all PPO members will be assigned a new group number and a new member ID. Now let's take a quick look at the Access Plus and Trio HMO plans. SFHSS members have the option between two HMO plans, the Access Plus or the Trio plan. The Access Plus plan and Trio plan benefits remain the same from 2024 to 2025. Both are HMO plans which require you to choose a personal care physician or PCP. These PCPs are associated with an independent physician association or IPA, or are often referred to as medical groups. Members must stay within their chosen IPA for all services. Both Access Plus and Trio plans are copay driven. The benefits for both the Access Plus and Trio plans are the same, with the network being the main difference between the two. The Trio network is a subset of the Access Plus network and is only available in select regions of California, whereas the Access Plus network is Blue Shield's full HMO network and is available throughout California. There are no deductibles, only fixed co-payments for most services like doctor's visits, urgent care, and emergency care. Both plans have access to virtual care with Teladoc. There are mental health benefits to help with depression, mental illness, and alcohol and substance use disorder. Convenient access to extensive pharmacy networks, including Safeway, Vons, Costco, and CVS. And personal assistance from Shield Concierge, our team of healthcare experts to find doctors, transfer medical records and prescriptions, and answer any healthcare questions you might have. Taking a high-level look at the benefits for the Access Plus and Trio plans, you'll see the benefits are the same. As I advised on the previous slide, the benefits are the same for both plans, with the network being the main difference between the two. Both have no deductible, with an out-of-pocket max of $2,000 individual and $4,000 family. Both have a $25 copay for PCP visits, a $30 copay for specialist visits, with lab work and Teladoc at a $0 copay. Outpatient surgery in a hospital is $100 per surgery, and inpatient hospitalization is $200 per admission. Both have a chiropractic and acupuncture benefit at $15 copay per visit, up to 30 visits per member per plan year each. There is no pharmacy deductible for either plan, with retail drug copayments of $10 per generic, $25 for formulary brand, and $50 for non-formulary brand. Programs only available to the Access Plus and Trio members include Shield Support Care Management programs, which provide nurse support, home visits, self-management tools, and workshops to help members with behavioral health, cancer, catastrophic injury, chronic conditions, LGBTQ health needs, musculoskeletal conditions and pain management, stroke, and the transplant process. For additional information, you can go to blueshieldca.com/shield support. Nurse Help 24/7 offers immediate answers to your healthcare questions. The lines are manned by registered nurses who are available 24 hours a day to answer any of your healthcare questions, including concerns about symptoms you are experiencing, minor illnesses and injuries, chronic conditions, medical tests and medications, and preventive care. For more information on this program, you can go to blueshieldca.com/nursehelp. The Away from Home Care program offers students, long-term travelers, and family members living apart access to health care from Blue Shield and Blue Cross plans across the country. The Away from Home Care program is available in 29 states and the District of Columbia, but availability varies by county within each state. Members using Away from Home Care services outside of California will receive the benefits offered by the host plan in the state they are visiting. To learn more about this program or to speak to a customer service representative, please call 800-622-9402. Now let's chat about a couple of exclusive programs that are available to Trio members only. The first is a non-emergency transportation service for members recovering from a serious illness. It offers reliable transportation to and from medical appointments. Eligibility is determined by a Blue Shield case manager. The second is a free meal delivery service, which offers convenient and nutritious meals during recovery from a serious illness. These meals are prepared and geared towards special dietary requirements. Eligibility and meal service delivery frequency is determined by a Blue Shield case manager. For information on either program, you can call the Shield Concierge team at 855-747-5800. Now let's take a look at the PPO plan. SFHSS members have the option of selecting the Blue Shield of California PPO plan. The PPO plan benefits remain the same from 2024 to 2025. The PPO plan utilizes the Blue Shield of California PPO network. You do, however, have the option of using an out-of-network provider for a higher cost share. This allows you the option to see any doctor of your choosing, both in and out of Blue Shield's network. Members may self-refer. There's no need to see your primary care physician first. Members have access to virtual healthcare via Teladoc. Members have coverage for medical care across the United States for urgent and emergency care anywhere in the world. And newly added effective 2025 is Blue Shield Connect, which includes access to customer service representatives and a dedicated care manager who are here to assist you with any questions you have, including help finding a doctor, finding treatment options, authorizations, setting health goals, and coordination of care. Taking a high-level look at the benefits for the PPO plan, you'll see the benefits remain the same from 2024 to 2025. The Blue Shield of California PPO plan is a co-insurance-based plan with a deductible which must be met before Blue Shield as the plan pays anything. The deductible for an individual is $250 and $750 for a family in-network, or $500 per individual and $1,500 for a family out-of-network. PCP, specialists, outpatient surgery in a hospital, and inpatient hospitalization are all 15% in-network after the deductible has been met, or 50% out-of-network after the deductible has been met. Chiropractic and acupuncture services are both 50% up to $1,000 max per member per calendar year after the deductible has been met. For prescriptions, retail copayments are $10 for Tier 1 drugs, which are mostly preferred generic drugs and some brand drugs, $25 for Tier 2 drugs, which is mostly preferred brand drugs and some generic drugs, $50 for Tier 3 drugs, which is non-preferred generic and non-preferred brand, and $50 for Tier 4 drugs, which are specialty and high-cost drugs. As previously discussed, AHSS has chosen to replace Accolade with Blue Shield Connect. Connect puts a team of nurses, health coaches, social workers, and other specialists by your side. This includes a dedicated care manager to help you support you and find ways to manage your health, all at no additional costs. Connect to a healthier you. To get started, you just call 888-499-5532. Next, let's chat about an exclusive program available to PPO members only. Brightline is available to PPO members only and offers virtual coaching programs for children with licensed behavioral health professionals from 1.5 years to 18 years of age. There are no wait lists, video visits with expert therapists and coaches, programs proven to help work with kids and teens, and support for parents and caregivers too. For more information, you can go to hellobrightline.com/Blue Shield CA or by calling 888-224-7332. Next, let's talk about mental health benefits and resources available to all three plans. Mental health benefits and resources are available via digital programs such as Headspace and Headspace Care, which is formerly Ginger, via Wellvolution, virtual care via Teladoc, Nurse Help 24/7 and Life Referrals 24/7, and in-person care via the Magellan Network for Access Plus and Trio members and the Blue Shield of California Network for the PPO plan. For Access Plus and Trio members, Magellan is focused on recruiting specialty groups with innovative delivery methods to meet members' needs and improve healthcare. Such groups include Charlie Health, Growth Therapy, Zoom, Equip, Talkiatry, Bicycle Health, Rhea Health, and Headlight. PPO members have behavioral healthcare options such as self-care digital programs and virtual care, which are Wellvolution, Credible Mind, Teladoc Mental Health, Life Referrals 24/7, and Nurse Help 24/7. They also offer the traditional network. Inside of California, members have access to Blue Shield's provider network of over 20,000 behavioral health clinicians and facilities. In-person and virtual options apply. And outside of California, members have access to over 34,000 behavioral health providers through the National Blue Card Network for in-person or virtual care options as well. Credible Mind is your virtual health resources hub. It offers articles, videos, podcasts, and newsletters. You can take a well-being assessment on a variety of topics, including stress, depression, anxiety, and more. You have access to crisis resources and hotlines. You can explore Blue Shield mental health services and programs, and you can find a mental health provider. To access, just go to blueshieldca.com/mental health. Now let's discuss pharmacy, the microsite, and additional programs available to all three plans. Blue Shield of California will be offering a new and improved pharmacy experience effective 1/1/2025. This new experience will offer a redesigned pharmacy hub, which makes it easy for members to manage prescriptions. It will also offer a side-by-side drug comparison, which will guide members to the lowest cost drug option. And it will offer notifications for members who have opted in to know when a lower cost drug option becomes available. Retail pharmacies will still include the major chains, including Safeway, Vons, Costco, and CVS. It will offer a 30-day supply and a 90-day supply of maintenance medications. Mail service will now be offered through Amazon Pharmacy and will include a 90-day supply for maintenance medications for the cost of only 2 30-day copayments. The specialty pharmacy for the 30-day supply for specialty medications will remain CVS. SFHSS members will also still have access to a microsite at blueshieldca.com/SFHSS, which will include an overview of Blue Shield plans, links to find network doctors, plan benefit documents, and details on programs and services. To find doctors, specialists, hospitals, and pharmacies, Access Plus members can go to blueshieldca.com/network HMO. Trio HMO plan members should go to blueshieldca.com/trio SFHSS. PPO members within California can go to blueshieldca.com/network PPO. And for PPO members outside of California, you will go to provider.bcbs.com. You will enter your location and you can browse a list of plans to find doctors that are in network in your area. SFHSS members can get 24/7 support for a low or $0 copayment from Teladoc. Teladoc Health doctors can treat many medical and mental health conditions, including cold and flu symptoms, allergies, respiratory infections, sinus problems, depression and anxiety, and grief and stress. To request a consult, you can visit blueshieldca.com/Teladoc or go on the Blue Shield mobile app. SFHSS members are also offered Maven, which provides virtual care support for if you are pregnant and up to 3 months postpartum. It offers on-demand virtual appointments with practitioners in more than 30 specialties, doulas, mental health specialists, and baby sleep specialists, care advocates to answer questions about your pregnancy, virtual maternity classes, support for pregnancy losses, resources to plan and prepare for a return to work after maternity leave, and support for family members. For information on this program, you can go to blueshieldca.com/maternity. SFHSS members have access to Life Referrals 24/7, which offers answers to simple questions like quick ways to de-stress or how to find more time in your schedule to more difficult issues like finding support after the loss of a loved one. Life Referrals 24/7 is here for you. How it works is you can call Life Referrals 24/7 to speak with a specialist ready to assist you with your personal needs. Or you can visit Life Referrals 24/7 online for tools, articles, resources, and more. When SFHSS members are experiencing an illness or injury that is serious but not an emergency, consider visiting an urgent care center to receive care that is typically faster and costs less than an emergency room visit. To find an urgent care center, visit blueshieldca.com/FAD and select urgent care. All SFHSS members have access to transgender benefits, which follow the World Professional Association for Transgender Health's WPATH standards of care, which include providers who specialize in gender-affirming services, gender reassignment surgery, hormone therapy, mastectomy, breast reduction, breast augmentation, associated surgeries and services as agreed with the treating provider, such as facial reconstruction, chin augmentation, lip reduction or enhancement, etc. A case manager is assigned to help navigate the healthcare system. You can learn more by visiting blueshieldca.com/LGBTQIA-health or blueshieldca.com/gender-affirming-care. Lastly, let's talk about Wellvolution. Wellvolution is your online hub to find the right virtual health program to support you and your health goals. Whether you're trying to lose weight, stress less, or even just increase your longevity, there is something for everyone on Wellvolution. We offer programs around emotional well-being, diabetes prevention, diabetes care and hypertension, weight management, tobacco and vaping cessation, and physical therapy and fitness. Enrollment is easy, and customer service is available on the platform. How does it work? Well, number one, you create a Wellvolution account. You visit wellvolution.com to get started. They'll confirm that you're qualified to receive the program at no extra cost. Number two is you get your programs. Pick one or more health goals you'd like to work on, and they'll recommend the best programs for your needs. You can make your choice and get started. And number three, become a healthier you. With the assistance of your program, begin making healthier choices about diet, exercise, sleep, stress, and your overall health. And again, customer service is available on the Wellvolution platform via instant chat, email, and telephonic support at 1-866-671-9644. New to Wellvolution is the Blue Zones Challenge. The Blue Zones lifestyle is a healthy and sustainable way to lose weight. It's shown to reduce risk of chronic disease such as heart disease, stroke, cancer, and diabetes. Participants even report more energy, sleeping better, and feeling less stress. What's included is eat the Blue Zones way without dieting. Set up your surroundings to support you, strengthen and build your social life, and reduce stress and boost happiness. Also new to Wellvolution is musculoskeletal health goal, fitness, and physical therapy. For low acuity, they offer general mobility via Sworkit. For medium acuity, it's a visual learner via Kia. And for high acuity, it's needs device coaching via Sword. Wellvolution also offers Virta Health Type 2 Diabetes Reversal Program. Virta Health is a digital clinical program designed to reverse type 2 diabetes substantially. Health risk requirements to enroll include type 2 diabetes and a BMI of 25 or more. The program is at no cost to members and includes physician-led care team, a daily one-on-one support from a dedicated health coach, personalized carbohydrate tolerance levels and diet plan, glucometer and diabetes testing and supplies, and a personal Fitbit. Also included in Wellvolution is Headspace. Headspace offers guided meditations, sleepcasts, music playlists for focus, sleep, and dance breaks. The coaches are of diverse ethnicities and genders. It includes a library of 500 plus meditations on everything from stress, sleep, grief, resilience, to compassion, tension releasing workouts, relaxing yoga, focus music playlists, and more. Meditations are guided and can be 3 minutes to more than 20 minutes, depending on what your need is and what you choose. Headspace is available in 5 languages, including Spanish, English, Portuguese, French, and German. Mental health is critical to your overall health. Headspace helps us look after our minds. Headspace Care is also included with Wellvolution. Headspace Care is an app-based and virtual care licensed medical provider. Behavioral health coaching offers members day-to-day support. The app includes a self-care library with interactive experiences that help members learn about and practice the valuable skills needed to manage stress, anxiety, and other day-to-day challenges via guided meditations, breathing exercises, recorded classes, and more. 80 to 85% of members have their needs entirely met by coaching. There is no copay for coaching services. Psychiatrists stand ready to support those in need of additional care, including prescribing medications. Health plan benefit designs dictate the member copays for virtual consults with clinicians. SFHSS has a $25 office visit copay for mental health. That copay applies for virtual consults with Headspace Care clinicians. Thank you for taking the time to attend this presentation. Should you have questions regarding this information or any other plan benefit items, you can always access this information at blueshieldca.com/SFHSS.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan, which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. The shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 3-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. We can help you get to your healthy place no matter where it is. We combine care and coverage, which makes us different than your healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you. Through our electronic health record, they can see your health history, such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, and pick up prescriptions, all without leaving the building, making your care feel easier, faster, and centered around you. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Now let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. At Kaiser Permanente, your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our industry-leading preventive screening rates help your care team catch problems early. And if you need specialty care, your team can connect you with specialists in one of the largest multi-specialty medical groups in the country. If you have a condition like diabetes or heart disease, you're automatically enrolled in a disease management program for personal coaching and support. Every contact with your care team is recorded on your electronic health record, which you and your doctors can access and review anytime, anywhere. This ensures that every caregiver you see has a full picture of your health without you having to repeat your story. From virtual care, video, and phone visits to in-person appointments, you can choose how, when, and where to get care for you and your family. Plus, stay on top of your care 24/7 with the Kaiser Permanente app or at kp.org. If you prefer to visit in person, same day, next day, and weekend appointments are available at most locations, and many facilities have labs and pharmacies in the same building. Because your mental health and lifestyle are essential to your total health, Kaiser Permanente includes many resources for self-care at no extra cost. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Kaiser Permanente doctors have one priority: your health. Your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our doctors and caregivers reflect the diverse communities we serve and provide culturally responsive care in many different languages. Your care team also uses your electronic health record to help you schedule checkups and tests. When you need care, you can talk to a clinician in person, over the phone, or by video. Same day, next day, and weekend appointments are available at most locations. You can also get advice 24/7 over the phone and online through an e-visit at no cost, saving you time and money. Telehealth services are not an add-on at Kaiser Permanente. They're covered at no additional cost by most plans and have been a part of how we deliver personalized care. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. No matter where you are, your Kaiser Permanente care team can see your medical history on your electronic health record, so you never have to repeat your story. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions in person, over the phone, online, or on the Kaiser Permanente app. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app notifications, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. Since keeping you safe and healthy is our priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at Minute Clinics located in select CVS and Target stores, the Little Clinic locations, or Concentra Urgent Care Centers when traveling outside a Kaiser Permanente area. If you seek urgent care at a Minute Clinic, the Little Clinic, or Concentra Urgent Care Center in a state where Kaiser Permanente is located but are outside one of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, there's the Away from Home travel line available 24 hours a day, 7 days a week. kp.org/travel is a special section of our website that's focused on getting care while traveling, and you'll have the ability to refill eligible prescriptions early in preparation for travel. When you're dealing with a serious health issue, your health becomes the center of your world. That's why you're at the center of everything we do at Kaiser Permanente. We're known for catching potential problems early with our robust preventative screening rates. If you do have a condition that needs more attention, you get excellent care from top-notch doctors across a wide range of specialties, including cancer care. Hearing that you have cancer can be overwhelming, but no member or doctor goes it alone. A multidisciplinary team of cancer specialists works with you and your family to determine the best approach to your treatment. Our experienced specialists combine earlier detection, cutting-edge research, and compassionate care. And we have access to groundbreaking clinical trials and other cancer research. We know that no two hearts are alike. There are many types of heart disease, and different people need different types of care. From initial diagnosis through treatment and into recovery, you and your doctor will make decisions about your care together, and you'll have guidance and support at every step. Through evidence-based treatments and comprehensive care and support, we help many members with heart disease live longer, healthier lives. In fact, Kaiser Permanente outpaces the nation in reducing deaths from heart disease and stroke. And our approach to prevention helps others avoid heart disease altogether. Personalized maternity care makes having your baby with us a unique and special experience for you and your growing family. Your dedicated prenatal care team will help keep you and your baby healthy and empower you to make decisions. You can add a midwife to your team too. Create a personalized birth plan of how you envision your day, and we'll help you have the safe and positive experience you want starting with your first appointment. You're cared for and supported at every step, from virtual and in-person tours of our private birthing suites to classes and online resources to help answer the many questions of expecting parents. Support doesn't stop at delivery. We offer breastfeeding consultation and other guidance to help your baby have a healthy start in life. Keep in mind classes vary by location, and some classes may require a fee. Your mind and body are connected. What you think, feel, and do affects your total health, and we are committed to caring for the whole you. We provide clinical and support services for a wide range of conditions, from stress and anxiety to drug dependence and autism spectrum disorders. Our mental health includes psychiatrist, psychologist, as well as family therapist, licensed clinical social workers, and addiction medicine physicians. And as a Kaiser Permanente member, you don't need a referral for mental health care. We also provide members with tools and resources to process self-care like guided meditation and wellness apps. Now let's see how we are using technology to give you more convenient ways to get care. Here are some of the wellness resources to help you stay healthy once you register at kp.org. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Join a program to help you lose weight, reduce stress, quit smoking, and more at no additional cost to members. Find helpful videos and articles, health calculators, podcasts, recipes, and more. Lastly, get one-on-one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and, most importantly, see results. And you can do it all from the comfort of home. Partnering with a wellness coach can help you manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity. As soon as you join, we want to make your care experience easier. We provide personalized onboarding with a welcome call and a member guide, so it's easy to get started. You can also visit kp.org/new member to get registered, choose your new doctor, transition your care and prescription seamlessly, and schedule your first appointment. If you still have questions, we are here to support you. Choosing a health plan is a big decision, but you don't have to make it alone. We're here to answer any of your questions so you can make an informed decision. If you have more questions, call the number listed on the screen. Thank you. This completes our presentation. May you live well, be well, and thrive.
Great, and now we're going to open it up to Q&A. I'm going to go to the beginning so we can see what questions members have been asking. Jay, are you able to see the questions?
I do. I can scroll and see if I miss anything here. I think every question has been answered as far as I know. Does anyone else have any questions at this point?
Actually, I think there's a couple that have not been answered around the posting of the presentation and how it would be communicated to folks.
We'll
I believe
post
we're working. Sorry.
Yeah, we can post the webinars by the end of the week. And just to make sure, so I'm going through some of the questions right now. Does Canopy Care extend to Southern California? Fred, can you please answer that?
Yes, can you hear me?
Yes.
Yeah, great question. So I answered that one in the chat. It does not extend to Southern California. It's just a Bay Area network, but for any urgently needed care emergency services, we do cover anyone that's traveling in Southern California.
Okay, and then are flexible spending accounts available to retirees? Olga,
That has been
you-
answered.
Okay, yes, but for the video.
Oh, yes, absolutely. So flexible spending accounts are not available for retirees, as that money is your earned income pre-tax that is used for the contribution for the flexible spending account. So it's only available for active employees.
Okay, and then we have a question regarding who contracts for mental health services for Blue Shield. It's Magellan. What about for Canopy? Fred, could you help with that?
Yep, that would be HealthNet Behavioral Health Services. And that phone number, if you're an existing member, that's on your current ID card. But it would also be on our information for that number or vendor search, all that would be on our HealthNet portal or microsite.
Great. And then how can I find MEA reimbursement rates for Medical Plan 2025? That is on if you go to our website and you go to our OE pages, sfhss.org/OE 2025, you can download the guide for City and County of San Francisco, and the MEA flex credit rates will be there. And for out-of-state college students and dependents, which SFHSS plans would provide out-of-state coverage? We can just go down the list. Jessica from Kaiser, could you answer how that works for Kaiser Permanente? And then Adam, could you answer for Blue Shield, and Fred for HealthNet?
Yes, so member is covered for the urgent and emergency care, like when the members' children's is our state. So if for the routine care, if the member's school is the same state as the home state, so they will get the same routine care as they are in the home state. So if the school is different at the Kaiser state, and the member, like for example, in Colorado, Georgia, Hawaii, and Maryland, and Oregon, the members can get the visiting student member ID card. Then they can get the routine care at the Kaiser facilities as the home states. So if the members like the school that is not in the Kaiser Permanente state, so the routine in-person care is not covered, but they can get the student health plan through the school. So that is the coverage for the visiting students.
Great. Adam, can you share how that works?
Yes, on the Blue Shield PPO, the student would, or the dependent living in a different state or different area, would simply just choose a doctor in the local Blue Cross Blue Shield network of whatever state they're in, and they could access coverage that way. If they're enrolled in the Access Plus or the Trio plan, and they're living out of state or going to school out of state or visiting out of state for any length of time, they would reach out to the Away from Home Care program and talk with a coordinator there to see if they are living or attending school in one of the 29 states that do allow this program, and then the member could access their benefits as if they were in their at their home.
Yeah, and for HealthNet, so we would only cover students who are, if they are going to school out of state, it would only be for travel, for urgently needed care or emergency services.
Great. That was a great question. I know a lot of our members have dependents that are in school, so thank you. And I see a question. Are you saying we are only allowed to change our primary within the first 90 days? I'm not sure which health plan, which video was playing during that question, but I believe for all of our health plans, you can change your primary care, and correct me if I'm wrong, Fred, is it once a month for
Correct, right,
HealthNet?
right. Yeah, that 90-day reference, that was just to let a member know if, let's say, you were auto-assigned a doctor and you wanted to correct that back to 1/1 of 2025, you would have up to 90 days to do that correction, and we would honor the change. But if you're assigned the right doctor, you're happy with that doctor, and you just want to change doctors at any time during the year, you would be able to do that every month.
Great. And for Blue Shield, I believe that's also the same, correct, Adam?
Yes, for the Access Plus and the Trio, members can change their doctor every month, and for the PPO, they could just see any doctor that's in or out of the network.
Awesome. And then I see a question, and for Kaiser, I'm sorry, Jessica, can you share how often people can change their primary care for Kaiser Permanente?
Yes, the member can change their primary care physicians anytime they want, and they can go to the kp.org, find the doctor and locations, and then they can search the doctor's profile, and then also based on the their like preference for languages need or other needs, so they can change the doctor anytime they want.
Great. And the next question I see is, are there any SFHSS plans which cover dependent parents? Olga, can you answer that?
Sure. So parents are not covered at this time. You are able to cover your spouse, your registered domestic partner, and children. And there's a variety of different child relationships that are also covered, but parents are not.
Thank you. And then I see a question we answered already. The presentations will be uploaded by, or this video will be uploaded to the calendar, the OE calendar, by the end of this week. And then another question about how do we access the PowerPoint or PDF for all the 2025 plan options. I highly encourage you. All of our health plans have created a custom microsite. You've probably heard them mention that during the video or presentations, and that has custom information for us. So I recommend you go to the different plan website. You can find them all at sfhss.org/OE2025. And then I see one. Okay, Fred was answering a question for Anna. Oh, now can dependent spouse have a different plan than employee, or do we both have to have the same plan, HMO, or both have PPO? Olga, can you answer that?
Sure. So if you are enrolled in a specific plan, any of your dependents, including your spouse, would be covered in that same plan. So there's not going to be an option to select a PPO plan for yourself while selecting an HMO plan for a dependent. Everyone in your yourself and your dependents will be in the same plan that you select.
Thank you. And then I see an e-benefits. a member says that they see the option to add dependents, but they do not see the option to remove dependents. How can a member remove a dependent in e-benefits, Olga?
So, in order to remove someone from your plan, it's just a couple of additional screens past the dependent list. That dependent list that comes up as one of the first options once you enter eBenefits is a list of all dependents that you've previously provided coverage for. And if you needed to add new dependents, you're able to do so by first adding them to that list. Once you proceed through the eBenefits process, you will have the option to deselect or select any new dependents that you would like. And you will have that option for each and every plan. So you'll have that as an opportunity for your medical selections, your dental selections, and for your vision. If and for your vision. And since we're on e-benefits right now and I have a captive audience, please, if you're using e-benefits, make sure that you are hitting that submit button at the end of your selections to ensure that we at HSS receive your selections and that you're attesting to the disclosure language that is preceding that submit button. At that point, you can also print your selection so you have kind of a receipt of what you've elected in e-benefits. So I hope everyone's has an opportunity to use eBenefits, and we do have plenty of how-tos on that, again, on our SFHSS website.
Great. And somebody else is asking about a pregnancy leave and how much their insurance premiums would cost. Olga, can you help with that?
Sure. So first, you're going to want to connect with your department's HR to ensure that your leave is protected. If you are going on to unpaid leave that is approved, you will need to connect with the health service system with us, and your benefits will continue at the same rate as you've had prior to going out on leave. But what you will be responsible for is making those premium payments directly to SFHSS. Since you're not going to have an active paycheck, those premiums cannot be automatically removed from the paycheck. There's multiple options to be able to pay: check, money order, and we also have an online portal. If you use an e-check, there's no additional fee to it. Credit cards do have, believe it's a 2%, with the minimum of $2 a fee, and you can set up auto payment in both options: e-check, no fees, or no transaction fees, and with credit cards, depending on what your preference is.
Thank you, Olga. And then I have a question from a member. I have a specific doctor I want to see. How can I figure out which insurance plan includes that practice? You can always call the doctor's office, or if you are curious which health plan, you can search the doctor finder on the Blue Shield. You can go to our microsite from Blue Shield and also the microsite for our HealthNet Canopy Care and do a doctor search that way to see if they are in network for the HMO plans, and for the PPO plan that accepts both in-network and out-of-network doctors. There could be a different cost for that one. I've lost the questions. Adam, do you have any more to add for that on how a member might be able to search for their doctor?
No, that's basically it. They could use the Find a Doctor tool. As you said, for the PPO, they can choose go in or out of network. If they have a specific question or are finding it difficult to locate the doctor, they can always go to the office hours and schedule an appointment to speak with someone.
Thank you. And sorry, I'm just scrolling down to the question. How does out-of-pocket maximums work? Adam, could you take that one and explain it?
Yeah, the out-of-pocket maximums work as you pay for your benefits, your deductibles, your co-insurances, whatever you're responsible for. Those will accrue to your out-of-pocket maxes. For the PPO, the in and out-of-network out-of-pocket maxes do not co-accumulate. So if you've met your out-of-pocket max in network and then you decide to go out of network, you do have to meet that out-of-pocket max as well. And for the HMOs, there's just the one out-of-pocket max. There is no out-of-network.
Great. And then we have a question about the what phone number to call for the PPO plan.
Yeah, currently through 2024, as I noted in the presentation, Blue Shield Connect will be replacing Accolade. But if you want to make a phone call and check benefits in 2024, you would still contact Accolade. And that number is the 866-336-0711. And then after January 1st, you will receive in with your ID card the information on your new customer service, and that number will be included on that, what we call an insert in the ID card.
Great. And then for another PPO question, for the PPO co-insurance, are the co-insurance amounts capped? Is that the same as out-of-pocket costs or out-of-pocket maximums?
Co-insurances are capped based on the out-of-pocket max. So on the PPO plan, you have a 15% in-network, which means you're responsible for 15% after deductible, and Blue Shield would pay the other 85%. Up to your out-of-pocket max. So you're never going to pay more than your out-of-pocket max. And again, you have an in-network and an out-of-network out-of-pocket max. We recommend you stay in-network. That way you're only meeting the one out-of-pocket. But co-insurance is the only way you could say they're capped, is that you'll never pay more than what your out-of-pocket max is.
Great. And I see that we are at time. I believe our team has been answering most questions in the chat already. So we want to thank everyone for coming today and for asking your really great questions. If you have more questions, please take advantage of our vendor office hours. And of course, our member services are also available to help you with any eligibility concerns or assistance. Thank you everyone for coming today, and we hope you found this helpful. We will be having 2 more of these active employee medical plan webinars, so please encourage your coworkers to come as well. Thank you so much.